society failed to give support. The society failed to identify. The society failed to have robust mechanism to ensure that this didn't happen. Suicides can be prevented. Prevention needs to be a global approach. Health organizations globally, policymakers globally need to work and ensure prevention becomes a reality.
Do you think that the mental health of an employee is responsibility of the company or the individual?
Let me flip this question. Do you think the health of the employee is one of the responsibilities of the organization?
What is something about the mental health at the workplace that really worries you?
See it like this.
What is something about the mental health at the workplace that really worries you?
See it like this. Over 10 billion plus days are lost every year to untreated, unidentified mental ailments. And we must understand this. I mean, see it from the point of, let's say I have an anxiety disorder. I am working. Now, my performance gets affected. I get more reprimands. I struggle to rise up or perform based on what the expectations are. I'm good enough. I work hard, but I have a condition which is impairing my performance, my functionality. So not only that I am struggling, the impact of this will happen on my immediate family as well. At my workplace, it will have on my performance, my collective performance, my work engagement, my job satisfaction, my overall wellness. It will also have an impact on the organization, so on and so forth. But if my organization would have helped me be more aware, help me identify this in time, help me with the intervention, supported me through the process, we're looking at what, a few weeks? From identification and then immediate intervention to significant improvement and being at your best level of functionality would be just a few weeks. So if that can happen, one will be able to see a difference, and workplace mental health, I think, needs to be prioritized. It's high time.
Yeah, it's a very interesting, I never thought from that perspective. The rates of suicide increasing, also the rates of anxiety increasing. Is there an issue with the corporate culture existing that is impacting this mental health crisis that we're having?
There are lots of questions in this one question. I'm going to try and split this.
Let's do it.
And it's a very deliberate thing I'm doing by splitting it.
Perfect.
Because a lot of times we connect what doesn't need to be connected.
Perfect.
Suicides can be prevented. Suicide prevention needs to be a global approach. I think health organizations globally and policymakers globally need to work and ensure that prevention becomes a reality. This is a global concern. This is not an India-specific concern. Yeah. When you look at mathematical comparisons, there will be country A with an X%, country B with a Y%. I don't think that X and Y in itself is the concern. The concern is the fact that we are losing human beings to suicide and the fact that suicide is preventable. That should bother us. That losing a human being to a preventable cause of death is a collective failure of the society at large. The society failed to give support. The society failed to identify. The society failed to have robust mechanism to ensure that this didn't happen. Whether it happened because of economic reason and we were not able to provide for financial security, social security that was needed, whether it happened because of mental health concerns and we were not able to identify and have the right intervention at the right time, and other factors. Whether it was because the access to crisis intervention wasn't there, the access to support systems wasn't there, the environment had a concern, any of all of this. But suicide prevention, so suicide and prevention need to be always spoken together is how I see it. Suicides are preventable. If we don't do it, we are failing ourselves. And this is a global concern. In fact, young people suicide is what has been seen as on the rise globally. And that's something that needs to be really addressed. That what are we doing at a school level? What are we doing at district levels? What are we doing at life skills level, mental health curriculum level, teachers, parent community, but also to look at the financial, social aspects as well. So those things, that's one aspect. Now coming to the question of anxiety. Now, globally you are looking at probably about anywhere 25 crores or 250 million plus minus people. Exact, I would not know. This could be a bit more also having anxiety disorders. The WHO's report post-COVID was that there was a 25% increase in anxiety and depression post-COVID. So when you are looking at prevalence like this, one needs to understand that you're also looking at a disorder. When you use the word disorder, you are talking about essentially a medical concern. So if I have thyroid, or I have hypertension, I have diabetes, there is a diagnosis, there is a treatment. Both of those are important, and they happen if I take the help, I reach the right person, that person gives me the intervention at the right time, so long-term impact is less. Same applies to any mental ailment. So if identification happens by awareness, if intervention happens at the earliest, then the person's higher level of functionality would also be achieved at the earliest. And we need to understand this. And that's why, coming back to what I was saying earlier on in the context of mental health, you look at the tremendous effort, tremendous work that has happened in India with Telemanas. Right? Telemanas is a government's initiative, which utilizes telemental health, and it's remarkable. So if you look at the Telemanas model, and let's say healthcare providers in the private segment, both standalone experts or experts in large healthcare provider networks, if everybody starts ensuring that both digitally and in the physical space, the access and availability is to the maximum that is there, we have a deficit of experts, no denial to that. So what do? You will need layers. You'll have a layer, and which is where I think in the future AI will have a role to play. You also have a layer at the, I do believe that family physician is the backbone of healthcare, and that needs to be strengthened, and that has been a strength for us, and that's how it should be. So that's when it comes to anxiety. Now the third part to your question is environment at workplace. Now let's split this in a couple of parts. One environment aspect is where the environment focuses on mental wellness, mental health, creates an environment where help seeking is encouraged, where you are also providing for support, making mental health care both accessible and affordable. That's one part of it. Second part of it is the environment, the psychological safety aspect as well. The environment. Now, you don't need me to tell you that if you are in an environment which is difficult, and how would anybody flourish there? So if you have a young kid in a school who goes through, let's say, bullying, how do you expect that kid to not have psychosocial and other impacts? Right? Similarly, at workplace, if you don't get the right support, guidance, yes, there will always be situations which are beyond us.
But why do you see today such a big problem in terms of mental health in our society then?
So one aspect is that mental illnesses and mental health concerns were there for a very long time.
Yeah.
We did not have enough experts. Awareness was not there. Access was not there. So there has been a problem, and there is so much stereotypy and stigma around it. Even today, people will say, if I share that I have a mental health concern, you'll think there is a problem with me. You may not be fair to me. I might be excluded, or so on and so forth. There is also stigma around medication. There is stigma around therapy. That exists. We can't deny the existence of that, because 3 in 4 people do not seek help. Is a reality, right? This is one part of it. Workplaces also need to look at the wellness or the mental health wellness aspect as well, which is work-life balance, which is environment, which is the culture of where you are working. Let's say you are going to a place at work where you are every day struggling because of interpersonal factors, and the team where you are working, or your supervisor where you are working, and you just don't work together. Now, these concerns also need to be addressed, and the overall approach in terms of, like I said, encouraging healthy practices, work-life balance is a non-negotiable healthy practice.
Yeah. So if I understood correctly, so there's one part is issue about what's happening at the organizations, whatever is the environment, the support, psychologically safety, and on the other side, there's also a reduced number of support of people that can health practitioners that can support, and also there's a stigma. Right, there's a stigma. So these are the three problems,
cost.
And also the cost. I love that you brought that.
The affordability also.
Yeah.
And easy access.
Yes.
So if you add the digital component.
Yeah.
I don't see a solution except telemental health.
Yeah.
In the near future, I don't see a solution, because how will you compensate for the lack of experts overnight?
Yeah, agree. I agree. And now let's look at when we look at the workplace, what are the main mental illness that you see that people are suffering most?
No, so how you see this is, in any case, when you are looking at mental illnesses, anxiety and depressive illnesses will be the highest, right?
Yeah.
So anxiety disorders and depression will be highest because their prevalence is higher than every other illness.
Okay.
So whether you are 20-year-old or you're a 40-year-old, whether you are in your school or college or at a workplace, because that's the kind of prevalence of any condition, it is what it is. You need, when you talk about workplace, you need to just split this. One is the mental illness aspect. Now, that mental illness aspect is not necessarily about your workplace. So let's say I'm a 30-year-old person who's having diabetes. I'm not having a diabetes because I'm at a certain workplace. And I'm not having diabetes because I came from a certain school.
Fair.
I have diabetes as an illness.
Yeah.
So that's one part. So keep the illness separate. Now keep the other part. Other part is your overall functionality, your well-being, is where workplaces can actually have an impact. So if you are having a tough routine, but you don't get a break, if you are working more hours consistently than what your mind and body can manage, if you are experiencing pressure and not knowing how to deal with the pressure, or the system's not helping you release that pressure adequately, that's the concern.
I see. And how can people identify those signs when they are at the workplace?
So see, if you're looking at how would I know if I am struggling at work,
That's it.
or how would I know a colleague is struggling at work? So you can look at various aspects. It could start with my physical health. If I'm having more physical health concerns, then it could also be because my overall stress parameters may also be affecting my physical health. Absenteeism. It will also be my level of engagement. So how involved I am, how connected I am, or how much am I able to enjoy what I'm doing. So my engagement level. Then you look at my interpersonal aspect, which means, am I gelling with the people I work with, or am I avoiding them? Has there been a change in my relatedness with them? My behavioral component, have I started becoming more withdrawn, more irritable, more aggressive? My external or a client interface, that have I started making more human errors? Have I started being more indifferent at times? Or am I feeling more cynicism, more hostility, or expressing it? Am I coming in late, going off early? Am I missing more deadlines? So some of these things are, if they are happening, so whether it is experiencing a burnout, whether it is experiencing stress, whether it's more in interpersonal, whether it's something happening in my personal life which may be affecting here, any of these aspects would be there. And this is not about an illness. So one needs to just split this in two parts.
Yeah. I really like. So one. So let's separate in the two parts. Wow, this was good. This was super good.
So
super good.
Illness has to have an intervention which is driven by experts.
Clear.
Experts need to be accessible for the employees, where the organization needs to support them and invest in it.
But how do I know that I'm in that point? I think that's the biggest problem is, for example, even with burnout, is that people. How do I know that I reach a point where it's more than my environment, or it's an illness? How do I know?
Simple answer: speak to someone. Talk to an expert. So if you are in your workplace and you are having any struggle, and it's continuous for a couple of weeks, how about if your organization has given you access to a mental health expert, you seek their help, you tell them this is what's happening to me, they'll tell you illness, no illness, medication, no medication, therapy, no therapy, lifestyle correction, some wellness, some exercise, some routine changes, or it is more support at workplace, or talk to someone, take some help, bring these changes. Any of this will happen.
Yes.
This will not happen if you don't seek help.
Yeah, but maybe you can help us. What are some of the symptoms that you might need external help?
So rather than looking at symptoms, you look at functional impairment also.
What is functional impairment?
So what are the various aspects of my functionality? So my social, my personal, my academic, or occupational, right? So if, let's say, I'm having some concern, if it is impacting my overall functionality, which means I'm not doing well, and or there is a downslide which is consistent, I need to seek help. Now, what are the areas? It could be my mood, it could be my behavior, it could be my daily functions like sleep, appetite, it could be my work, it could be my own self, my thoughts, any of these aspects, my lifestyle, so any of these aspects together, when there is a struggle happening for a period in time and causing impairment, that's when I seek help.
I see. What can be considered a period of time to think of, okay, I might have a more serious issue?
So I would not like to use the word serious. I'll say that if I'm having a functional impairment which has crossed the 2-week mark in a consistent manner, I should seek help.
Perfect. Yeah, that's what I wanted to understand. Yeah. So You see if there's an impediment.
Functional impediment.
Yeah. So if there's a functional impediment, and if it drags for, let's say, more than 2 weeks, then there might be signs that
there may be a concern.
Exactly. Yeah.
So whether it's an illness or a non-illness, it requires guidance, lifestyle correction, an approach, whatever it is.
Yeah.
Seek help, talk to someone.
Yeah. Something that is that happens, and you already mentioned, is about the stigma at the workplace dealing with mental health. If someone is facing issues in terms of their mental health at work, what is the best way to approach, for example, with a manager or with the company?
So the honest answer is it's not that easy.
Yeah.
So I'm not going to just wake up and be able to talk about it unless you've given me the confidence that I can talk about it.
Yeah.
Right?
Yeah.
So if I have seen around me in my organization that people hesitate to speak up, or if somebody speaks up, then they're mocked at, or they're criticized, or they're looked down upon, then I'll not speak. So you first create a culture where I feel openness is there, right kind of support is there, and I see that happening, then I'll be able to speak.
And when that is not there?
It's a tough one. It's a really tough one. Because let's say if you come to me asking me for help or telling me that you are seeking help, and I get back and tell you this is all nonsense, this is all rubbish, how would you feel?
Yeah.
Right? You would maybe even doubt the help coming to you. You would even feel that maybe now I may not treat you fairly, so on and so forth. There are various permutations and combinations. But not only that, you will hesitate to speak to anybody else in the organization anymore, or maybe another organization if you go to, because you think this is how everybody thinks.
Yeah.
And even your colleagues who were aware about this would also have this learning by observation.
Yeah, I see. So you kind of know the environment that you are, and you kind of feel that if it's okay or not. If it's not okay, then you need to find other solutions in order to handle whatever the person is going through, right?
You do what you can do.
Yeah.
I do feel that outside my control is not my control.
Yeah.
So I can do what I can do. I can't control what you'll do. So external locus, internal locus.
Yeah.
Internal locus, my control.
Yeah.
I can come on time. I can do things the way I think are the best. If a traffic jam happens, not my control.
Yeah.
Similarly, I can go and seek help, but if you are not going to support me about it, I can't change your views. But I shouldn't let your views affect my help-seeking behavior for my own well-being.
I love it. Yeah. So we spoke about extreme situations where there's a deeper issue. At individual level, what can be done in order to prevent mental illness at the workplace?
So I still feel the question would be that what can I do to have the best mental health, be in the best zone from a mental health point of view at my workplace.
That's it.
Because the moment I say illness,
I agree.
I'm looking at intervention and treatment and so on and so forth.
Fair.
To answer illness, if I feel I'm having an illness, I should seek an expert. If my organization is providing me support for an expert, I should utilize that.
Yes.
If that's not the case, I should go ahead and talk to either my family physician, ask them for the advice, they will direct me if need be, or they'll solve it for me.
Perfect.
That's what I should do.
Yes.
What can I do for my own mental health at my workplace?
That's it.
That question, what can I do? I need to invest in social support. I do not feel that in absence of friends at work, we will be at our best level of functionality. I don't subscribe to the fact that I have a personal life and great friends, but at work I have no friends. You're going to spend way too much time there, and both your triumphs and tribulations are going to happen at workplace. You need support system. Invest in that. So I should have, I should communicate well. I should share and express my thoughts and feelings. I should be open to feedback. I should be open to learn, and I should make good friends at work. And I should have my own work ethic, which means I should complete things on time. I shouldn't have my backlogs. I should know when to take breaks. I should know what to do in breaks. Even during my working hours, I need to know that I need those mini breaks, and I should be taking them. I should know if work's piling on, I should seek help. If I feel that I am having more work than I can manage, I should share that with a supervisor, explain it to them, and I should balance my work life, and I should take care of my own emotional needs as well. A me time, how do I take care of myself, my physical health, all that is in my control, I can do that. What I can't do is, if there is, let's say, a concern in an individual in my team, that may not be something I can have an influence on. Or if the organization is not having an approach when it comes to encouraging best practices when it comes to health or mental health outside my control, I'll still need to do my best.
Yeah, I really like. So what you say is like, you start with the things that are in your control that you can do, and you mentioned a lot of them. Now, if we come to the company, something that I'm curious, do you think the mental health of an employee is responsibility of the company or the individual?
Let me flip this question. Do you think the health of the employee is one of the responsibilities of the organization?
That's exactly the question.
No, I'm asking you. Do you think in your team, the well-being of your colleagues and their health is one of your responsibilities?
Yes, this is very controversial. It is a very controversial topic. I truly believe it's the organization's responsibility.
So your responsibility is to provide for the right kind of support and environment, right?
Yes, that's it.
Now, if you are providing for the support and environment for health,
yeah,
health is not health without mental health.
Can you say that again?
Health is not health without mental health.
Okay, yeah.
So if next time somebody says that we support our organization for their health needs, and if mental health is not included, then they're not providing for health needs.
Yes, I see.
You should ask people, I challenge you to define health without putting mental health as a component. You can't.
Yeah.
It's in the definition.
Yeah.
Emotional, social, mental, psychological, spiritual. So?
Yeah.
So when we say the responsibility, I am not saying that the responsibility is that you need to ensure you are preventing something which may not be preventable. All I am saying is you need to create access and support interventions, provide for the best solutions, and have the right environment that the organization can do.
Yeah, I really like that. I think I agree. I think and you just mentioned, so on one side there needs to be an element of the individual to work on themselves, and whatever they can do, they can control. But then there's also responsibility of the organization to provide the environment, and also very important what you said, to provide the access to building a positive and healthy environment for the employees, right?
See it like this. If I'm coming too late at work every day,
yeah,
and I'm not finishing what I'm supposed to do, which I could do in a day's work, and after about a couple of weeks, I have a piled on work, I'm behind most of my deadlines, and I feel the stress, it's my problem. I should have resolved it. It's my work ethic. But let's say I'm coming on time, I'm doing as much work that I can, but my organization is asking me to do work for 3 people rather than 1 person, which humanly I can't complete in time. And for me to complete that, I'll have to probably cut a few hours of my sleep and other aspects of my life. Then it's the organization's problem. Now that's the difference for you. Both need to go hand in hand. My approach, work ethic, and you as an organization provide me fair ways of contributing to my best.
Yeah.
So if you are, to give you a sport example, if you are a marathon runner, you don't run a marathon every week. After running a marathon, you need a significant break to recuperate, right? Similarly, if you are a 100-meter sprint, you don't run a marathon with a 100-meter sprint speed, right?
Yeah.
So some things are about my body, my approach, and some things are about the environment. Both things have to be taken care of.
Yeah, I love that. I really, really love that. So now if we focus more on the organization, tell me what good looks like. What is an organization that positively impacts the mental health of their employees? Give me that picture so that we can see what success looks like.
So let me look at what all an organization can do and give it to you in a spectrum. And here I'm largely putting mental health as a context.
Exactly, yeah. That's where we want to focus.
So my organization should ensure that we are aware about mental health. Our awareness about mental health needs to be high. So mental health literacy, right? That's one part. Now, if I'm aware and if I'm coming to you and sharing something, if you don't respond well to me, or you respond with let's say stigma behavior or discriminate against me, then again that purpose wasn't solved. So you train people into mental health first aid or psychological first aid.
Yeah.
Empathy, non-judgmental, positive. Moving forward, you also provide me for upgrading my skills regularly. Somebody may require more support in communication skills. Somebody may require help with social. Somebody may require with some coping skills, life skills. So you keep helping me upgrade. You then have an approach where you are focused on the well-being as well. Yes to targets, yes to numbers, yes to EBITDA, yes to profits, yes to everything. But knowing that you are working with humans and their well-being needs to be taken care of, and their well-being will actually convert into your targets as well, but not in the absence of that well-being. Moving forward, you provide for intervention opportunities if they are going to be there. Meaning, if I am struggling and I need to talk to someone, my organization is making sure I have access to someone, so that I don't need to go here and there. I know there is a trust factor, and then I'll seek help and I encourage that help. And in the intervention, self-help, lifestyle, psychological support, and medical intervention. All of that needs to be there. Self-help.
Self-help?
Meaning I should know where I need to change my own self. Second, lifestyle. There are things in my lifestyle, my approach, my life skills also where I need help. Then intervention with an expert, which is a psychological expert for my cognition, my emotions, my relationships, other aspects of my functionality. And last would be the medical intervention, where people like me might want to prescribe you a medication because let's say you are having a depressive illness where you have moderate to severe illness where you need a medication. So all of that needs to be happening within the framework of the organization.
Yeah, that is so good, doctor. That is so good. So what you say that the first thing you need to make sure that there's mental health literacy in the company.
Mental health literacy, mental health first aid.
That's it. So that's the first. The second thing, you need to make sure that you are investing in your people, developing them, giving the right environment for them to perform.
Yes.
And the third, you need to make sure that you give them access whenever they need anything in terms of their mental health, they are able to access to that, right?
Yes.
That's so good. I think let's go a bit deeper because there's a lot here. Let's break it down. So, for example, in terms of literacy, what is something that people can do that for their organizations to be better prepared in that area?
Mental literacy would be knowing when to seek help.
Oh,
Most important.
yeah.
Second, knowing the narrative, the language, the words that we use, especially around mental health. Third would be our approach needs to be without stigma, where we see mental health like any aspect of health. That's mental health literacy for you for workplaces. Mental health first aid, second part. I'll use the WHO's look, listen link. Look, learn to identify who would need help. Listen, which means bring empathetic, non-judgmental, supportive approach in your approach to them. And link, which means help them to the solution. So mental health literacy, mental health first aid.
Yeah, I really love it. Yeah, so we are getting now it's more, the picture is more clear. So what we discussed is every individual is responsible for their mental health, and there's many things that are within our control that we can do. The second thing are the organizations that they have the responsibility to provide the literacy to their employees, but also invest in their employees and provide the help that they need whenever they need, right?
Yes.
If you would have to drastically improve in India the mental health situation at work, what would be one radical solution you would think about to solve the problem?
No, I think organizations need to create access and awareness both, which means I'd want organizations to invest into creating mental health first aid, psychological first aid, almost like a mandatory aspect of the organizations.
Yeah.
So for example, how you have ACLS, BCLS, CPR trainings, right?
Okay.
We give them. So you are giving them because what if someday somebody would require an intervention, a CPR intervention, which is life-saving. So here also, it's life-saving in its own way, because people go through their struggles very regularly. They're emotional, they're interpersonal, personal. So if you get support from your colleagues, it will make a huge difference. So you do that, which is the mental health first aid. You make it a mandatory part of your training.
So good. Yeah.
Do that. Mental health literacy is an ongoing process.
Mm-hmm.
You can't have once a year on World Mental Health Day a psychiatrist or a psychologist or somebody coming and telling you about this. Some people attend it, some people don't, and then you forget it for the next 365 days. That's not how it works. You do it regularly so that this awareness takes away two things. It has an impact on the stigma, which reduces discriminations, and the other side, it increases help-seeking behavior. Like I said earlier, 3 in 4 people needing help do not take help. So that 3 people are being impacted by either the stigma or not, and thereby not seeking help. So if you act on both of these vectors, encourage help-seeking, reduce stigma, automatically it will change. These 2 things organizations should do: mental health literacy mandatory, mental health first aid mandatory, and all organizations need to have mental health support from anybody that they want to, but it should be there. Like how for schools we say they need to have a counseling system, psychological support system mandatory. I think workplaces should have that as well.
I agree. I am so happy we're having this conversation. This is so important. I mean, for me personally, and I'm also doing what I'm putting that as a priority for my company, but also bringing more awareness in these conversations. I think we are coming to the end, and maybe if someone is struggling and comes to a leader and with a mental health, let's say, issue, not an illness, what is the best approach to handle it?
Be non-judgmental. bring empathy. In absence of these two aspects, nothing else will matter. Compassion, which is your empathy in action. Compassion. Help this person towards a solution. Solution may be, I'll get you connected to, let's say, a mental health expert. Or, okay, you're having this problem in your workplace, let me talk to your supervisor, see what we can do. Or maybe this skill set of yours can really make a difference. I have seen some very good areas. If we work on this thing, it will make a difference. I'm going to guide you to someone who will help you raise this bar, because this is how we can see. Either of these things, based on, or anything else. It could be something affecting this individual from their personal space or their workspace. So your approach needs to be of psychological first aid. So you recognize they have a concern, you approached it in an empathetic manner with compassion, and you help them towards leading a path towards a solution.
So good. I love it. Yeah. It all starts with empathy, right? And listening without judging. That's
yes. In these times, we are quick to judge.
Yeah.
We are quick to a 2-second scroll here and there, and like and not like.
Yeah.
We are quick to pass a comment. We are quick to dismiss, disregard at times, even very harsh when we respond. I think we need to bring more kindness.
Agreed.
Even if we don't like something, there is a way to say it, especially when you say it in a open, public spaces, whether it is social media or your workplace places. And I think that's important. We're just way too quick to judge. We are way quick to pass judgments. We are we label way too much. I think our empathy has probably not being what it could have been and should be collectively as a society globally. And I think we need to, humankind needs to, I had mentioned this some time back, humankind, right? Humane kindness.
Yeah.
So if we are not as humane as what we should be, and if we are not kind as what we should be, we are not humankind.
Yeah.
So we need to be kind to our own selves and reduce the hostility, reduce the criticism, encourage, support, feel that at the end of the day it's a collective. And it is not a race, like it or not.
That is so good. That's such a beautiful way to end our conversation. I think just to end, for me, I would like to give you also my thoughts. I think it's not easy today also as a leader. There's a lot of pressure, as you said, for results, for performance. It is not easy. But I think there's one thing that I truly, truly believe is that if leaders, they don't address the basics, for example, of their teams, their performance is going to be impacted. I had an example of someone that I was coaching that she had a personal problem, and that was impacting a lot her performance at work. So if we don't have leaders which are empathetic and help their teams to become better, it will impact the results. And I agree with you. We need more kindness. We need more people that listen and focus on people, and the results will be a consequence of that. Very good. Final message, if there's one thing that you would like people to remember from this conversation, what it is?
I think mental health needs to be a priority. Whether we talk of any age group, any strata, any area of our life, in absence of positive well-being and mental health, nothing is worthwhile. So if any organization has a vision statement, a mission statement that most organizations have, or value statements, none of them can be complete without prioritizing mental health.
So good. I'm incredibly happy that we had this conversation, and I'm really happy to amplify more these conversations, because we need to have more conversations about mental health, especially where we are today. Thank you so much for coming.
Thank you.